How to monitor your blood sugar at home. This presentation will show you how to easily monitor your blood sugar at home, and after that we will go over some other helpful diabetes tips. Generally, you should check your blood sugar at least a couple times every day. Once in the morning before breakfast, and again in the afternoon about an hour after you have a meal. Now, some people will need to check their blood sugar more often, and your doctor will tell you what times throughout the day you should be checking. And if your doctor tells you specific times to check, write these down so you don't forget. Now we'll go over what you need to check your blood sugar. First, make sure you have all your supplies. You should have your glucometer, the glucose meter, a test strip, a lancet, which is what you use to poke your finger, a cotton ball or some gauze, an alcohol pad, and whatever you use to record your blood sugars. Now, we'll walk through the steps of checking your sugar. First, wash your hands thoroughly with soap and warm water. Second, insert the test strip into the monitor. Then, clean your finger with the alcohol pad and prick your finger with the lancet. Use the side of your finger rather than the tip or the pad. Gently squeeze around the prick until you can get a drop of blood that you can hang from your finger. And touch the blood drop to the end of the test strip. Once you get a reading, record that reading in your app or on the piece of paper. Remove your test strip with a cotton ball. And if your blood sugar is higher or lower than normal, check again to make sure that is an appropriate reading. Next, we'll talk about how to log your blood sugar value so you can keep track of these numbers. You should record your blood sugar whenever you measure them. There are a few different ways to do this. Pick whichever one is right for you. If you have an iPhone, we recommend downloading the Glucose app. That's the first picture you see on the screen with the blue droplet. It's free. If you have an Android phone, we recommend using the Blood Glucose Tracker app. That's the second picture you see with the heart and the red circle. This is also free. If you don't have a smartphone, the best way to keep track of your blood sugar readings is to record them on a sheet of paper. Keep this somewhere safe so you don't lose it, and remember to bring this into your doctor's office when you go for your next appointment. Here are a few pictures showing you how to use the Glucose app if you're an iPhone user. You can type in your number from the glucose value, choose the time of day when you measured it, and log the date and time. You can always see your previous values, even those you just recorded earlier in the day. This will help you see how your glucose levels change throughout the day. This app will store all of your values for you, and even put them into a report for your doctor to see how you've been doing. This is the Blood Glucose Tracker app, the one we recommended for the Android phone users. As you can see from these pictures, it allows you to log your glucose values. Input what time of day you measured them and record the date and time. This app will also store all the values you record and can create a report for your doctor to see whenever you come in for your appointment. And if you don't have a smartphone, then pen and paper is the right option for you. The free clinic can give you the sheets you need. Just like the apps, you can log your values next to the date and time when you took them. Keep these papers in a memorable place and make sure you bring them with you to your next doctor's appointment. Alright, in case your diabetes isn't managed well, as your doctor would like, here are a few dietary tips. There are 3 big things to remember when thinking about what to eat or drink. Number 1, cut back on sweets. Watch out for sweet tea, soda, sports drink, and sugary desserts. Number 2, eat less starches. These are a lot of your white foods like white bread, potato, white rice. These foods are high in carbs, and too much of these is bad for somebody with diabetes. And finally, drink more water. This should be your main drink with every meal. Look at the picture in the bottom right for an easy way to think about your meals. Half of your plate should be vegetables, a quarter should be protein foods, and the other quarter should be carbs. And water should be your drink. Exercise. Exercise is very important for somebody with diabetes. It can help control blood sugar and prevent disease complications. So let's go through some common exercise questions people ask. So how much should I be exercising? The goal is 150 minutes of moderate intensity exercise every week. This may sound like a lot, but if you exercise every day, This is only about 20 minutes per day. Well, what is moderate intensity exercise? That is the same intensity as a brisk walk. Any activity that gets your heart beating a little faster is great. Well, what if I don't have 150 minutes every week? Try making it part of your routine, like fitting in a walk after dinner a few days out of the week, or using breaks at work to walk. If you can't quite make the goal of 150 minutes, that's okay. Some exercise is definitely better than none. And if you're able to handle a higher intensity activity like jogging, then you only need 100 minutes per week. Some people say, I'm pretty active at work and I don't need to work out. Well, it is still important for people with active jobs to exercise outside of work. The benefit from dedicated exercise time has been shown to be much greater than activity at work. So, the big things to remember from this video. Be sure to check and record your blood sugar daily whenever your doctor has told you to check. Use the plate method for an easy way to plan your meals. Try to exercise most days out of the week. Again, some exercise is better than none. And please ask your doctor if you have any questions about diabetes. Thank you.